We're going to walk through a number of pathologic conditions to help reinforce some of the thoracic anatomy that we've discussed. So first off, I wanted to start out with this chest x-ray and give you just a moment to try to look at it to see if you see anything abnormal. So I'm going to draw your attention to an area right over here on the, again, left-hand side of the patient, and you'll notice that there is a bit more of an opacity there than what you would typically expect to see. And so it doesn't look like a whole lot on chest x-ray, and so oftentimes this is where you'd want to perform a CT scan in order to better visualize what, if anything, is going on there. And so here we can see in this axial view, you can clearly make out, in this case, a lung tumor at that point. So again, the CT scan makes what obvious what is relatively difficult to appreciate on x-ray. Here's another example of a pathologic condition. So again, I'll give you just a moment to look at this image here and see if you notice anything abnormal. And so again, you want to make sure that you do a systematic review, and so pause it if you need a little bit more time to look at it to see if you can identify anything that's abnormal. Again, appreciate your normal anatomy and look for what the normal anatomy should look like. And so I'm going to draw your attention to the costodiaphragmatic recesses, and hopefully you notice that the symmetry is quite a bit different between the two sides, and so you have blunting over here on the right costodiaphragmatic recess. And so then on imaging, or on CT imaging rather, you can very clearly make out the fact that there's a pulmonary or pleural effusion located down here. So again, very obvious on CT, whereas it's not particularly obvious on chest x-ray. And again, this is just going through a couple different views of this pleural effusion, and so this is a good chance to practice some of the anatomy that we've talked about here. So make sure you can identify the right and left pulmonary main stem bronchi, the descending aorta, the azygous vein, the ascending aorta, etc. Here's another chest x-ray. So again, you want to be looking to see if you see anything that is abnormal in this scan. And so at this point, the key here is that there's not a good AP window in this individual like you would normally expect. You don't really see a good aortic knob and then the left pulmonary artery like you'd expect to see with that AP window in between. And so but again, it's not easy to appreciate on this chest x-ray. But again, what we're going to do is we're going to look at this then on CT to get a better view of it. So again, here you can see the heart. So this is going to be coming off the left ventricle over here. So this is the ascending aorta. This is where the aortic valve is located right here, and so you can see the ascending and arch of the aorta. And as we follow that around, again coming around the pulmonic trunk, here you can see the right atrium over here, and again the innominate artery, the left common carotid, which you can really well appreciate right here, the trachea, of course. And again, we're still just following this around here. You can see the pulmonary veins, and then here's where you really get a good appreciation of what's going on in this person. So these are large, very large lymph nodes in this patient. And so what's happening here is you can see, especially this lymph node and this lymph node right here are causing an occlusion of what you'd expect to see for the AP window. And so again, when we look at the comparison between abnormal versus normal, I think that's where you can get a good appreciation, where again, you shouldn't really see lymph nodes on this image, but over here you can see, or at least they should have a very small appearance, like you can see here. But on the left-hand side, you can see these very, very large lymph nodes located in this region, and so again, that's going to be occluding this AP window on this individual. And so just going through a few more images on the same patient, so we can see the trachea with the carina right here, and the left and right main stem bronchi. Great area to appreciate the difference in angulation between the left and the right main stem bronchi. And again, we'll just kind of keep following these down. And then now looking at a lung window, so this is another condition. So I want you to just kind of look through the scan, try to appreciate the normal anatomy, make sure you can identify all the different structures that we've talked about previously, and then we're going to start going through some of these. So again, feel free to pause the video if you need a little bit more time to do your analysis. But where I want you to start on this one is start with what you know. So again, find your thoracic viscera or vertebra, locate the descending aorta. Here's your ascending aorta. This is going to be probably the end of the SVC, moving into the right atrium, right ventricle over here, and then back here is going to be then the left atrium. And so these dark areas back here are going to represent the bronchi, but you can see again that they've clearly already branched. So you're looking at probably the tertiary bronchi at this point. But what you'll notice is with the pulmonary arteries right here that they have sort of a unique appearance. And so when you look at this on a CT pulmonary angiogram or a CTPA, you'll see that there's what we call a central filling defect surrounded by contrast in each one of these on either side. And so this is an example of pulmonary emboli, or a pulmonary embolism here, and another one over here. So plural is emboli. So you have pulmonary emboli in this patient. And so they have this appearance of a mint, like a polo mint, like shown down here. So again, you can see how it kind of has this donut-like or mint-like appearance with a dark center and then contrast enhancement surrounding that central filling defect. And so you'll see in this patient that they have very severe examples here of pulmonary emboli. As we go through these scans, you'll be able to, I think, appreciate these. Again, you can see some more over here. Again, showing up there you can see an embolus. There's another one right there. Still over here, you can see another one right there. And then again, here you can see, again, very, very significant emboli. And so we're moving our way superiorly right now. So again, if I go back to the initial image, so this is the most inferior image, and then we're slowly ascending superiorly. And so once again, you can see clearly this is going to be the right ventricle over here, and it's kind of the start of the pulmonary trunk. So you can follow here, you can see the entirety of the pulmonary artery, and then right about this point is where it's going to be giving off the right, and then eventually you'll see the left right here, pulmonary artery coming off. So again, left pulmonary artery, right pulmonary artery, which remember the left pulmonary artery is higher than the right, so that's why you're seeing the left one later on, because again, we're moving superiorly in this image, so we're progressively getting higher and higher up in this patient. And so again, you can see this fairly large number of emboli and really just overall large appearance of the emboli in this patient, especially in the left pulmonary artery, though they do have evidence of clots on the right-hand side of their body as well.